very sudden, okay, and this is what expresses the acute exacerbation. Okay, what is the next characteristic? There is a history of viral infection or chickenpox or measles or mumps. Something or other is there very clearly. The attacks are very erratic, as I have explained you, and with a sudden severity it may increase. You may find the patient is very severely attacked, and again suddenly everything disappears and the patient is in the normality. So sudden erratic response in severity and the disappearance. Clear? Another aspect, there is a tubercular base and expression may be present. So there could be a past history of tuberculosis, past history of infections, or a family history of infections. Very important in tubercular miasm. Cough with excessive expectoration, which is mucopurulent. Okay, so that is excessive. So if they do a huge quantity of expectoration will drop out from their mouth, huge quantity, which is yellow. Why? Because that is an infection. It has to be thrown out. The body tries to throw it out. The next aspect, with easy suppuration with infection and fever, and they are very difficult to manage. Suppose if you get a case with a fever, it's very, very difficult. So if it's a bronchial asthma along with bronchitis, you will find it very difficult to manage. And what is the repair? You know, morning you understood this. The repair is by fibrosis. And when there is a repair by fibrosis, it is very difficult to manage. It will decrease the pulmonary function, the respiratory function will come down, the vital capacity will decrease, the abnormal residual air which remains inside will increase. Okay? And they will feel breathless even in normal circumstances. So even if they are in a normal phase, they will feel breathless. So even if they are sitting down, you know, they are sitting down. They will feel breathless. Why? Because there are fibrotic changes taking place. The residual dead space has increased. You know, in the morning you learned about the dead space. So the dead space is more and more. And then it is very difficult to manage this. Then we go to the final phase, the syphilitic asthma. So now what happens when you keep on suffering over a period of time? The emphysematous changes take place. Emphysematous change will take place, so the lung will not be able to give enough oxygen. So if the lungs cannot give enough oxygen, the heart has to pump out more blood. So if heart has to work more, it will lead to call pulmonare, and finally the patient will succumb to the disease. So what we have tried to understand, what is the basic aspect of bronchial asthma. Secondly, we studied the types of bronchial asthma, then the chances of cure and the less chances of cure, and then we understood how different miasms affect bronchial asthma. So when it comes to the syphilitic phase, on auscultation you will find always residual bronchi without even attack of bronchial asthma. Now we will study, and then we will take up cases. Okay, we'll study the potency and the repetition, because this is a predominant aspect of management in the soric phase. Usually it's a constitutional disorder. It doesn't have much of acute totality, which is very clearly expressed. So normally a constitutional remedy in high potency, 1 or 2 doses, will relieve the patient, and repeat only if required. The response which you desire, what if your medicine is right? It has to reproduce the skin symptoms and the spasm should disappear. The first thing which the patient will feel, mentally and emotionally the patient feels better. Why? It is predominantly intrinsic kind of asthma. Okay? So the patient will feel better. The skin symptoms may reappear, but the same constitutional medicine will take care of this aggravation. You don't need to change any medicine. Your one medicine which was selected based on constitution will take care of it. No intercurrent or acute remedy is required. Okay? So no intercurrent or acute remedy is required. It's a very clear understanding. Psychotic phase. Usually you require acute medicine in low or medium potency or frequent repetition. Why low or medium potency? Because it's a beginning of the disease. There is an acute totality, acute exacerbation with clear-cut acute totality, and you require, because you are giving in low potency, you want to give it a frequent repetition. So when you give a frequent repetition, the disease gets controlled faster. Intercurrent medicine is required. Why? Because by this time the suppression has taken place, disease has gone to the next level. So you require, and usually these are the cases where there is a very strong psychotic history, either a family history or a past history of psychosis. So you might require some intercurrent medicine in a medium potency. So you may give it in 200 potency or 30 potency, and a constitutional medicine is required again in 30 or 200 potency with infrequent repetition. And what is the time? What is the right time to use the constitutional medicine? In the psoric phase, never give in this phase the constitutional medicine. What will happen? Boom! You will get a severe aggravation. So where should you introduce your, where should you introduce your constitutional medicine? In psoric? Here or here. So these are the 2 points where you should introduce the constitutional medicine. Now we come to psychotic. In psychotic, where should you introduce? You can introduce it here also, here also. If it's very well indicated, you can introduce it here also, you can introduce it here, you can introduce it here. So in psychotic, you can introduce it at multiple points. Again, preferably don't introduce it here because it can, but it will not go up to that level. It will get slightly exaggerated in the psychotic phase. So at the psychotic phase, you can introduce at multiple points. In tubercular phase, what did we understand? If you introduce constitutional here, it is excellent. Excellent. Because what will do? It will prevent. Very good. It will prevent, or in other words, it will abort the process of acute exacerbation. फट करके disease control में आ जाएगा. You don't have to get worried. But in tubercular, you never introduce it here. Never, ever, never, ever. Never. Never give at this phase. If you introduce a constitutional medicine at this phase, you will find a severe aggravation +5. Because this is a phase of remission. The sensitivity of the patient